One of the things that I found so important is giving people a pathway and a framework and making them understand this is not something that's taught in school, in higher education. It's not even taught to you by your doctors.
Of the Unraveled and Rising podcast. I am your co-host Michelle with my wonderful co-host Terry. Hey Terry.
Hello. Hi everyone. Thanks for being here.
Nice to see you. Kimberly, and they just came back from a wonderful excursion with Dr. Joe Dispenza in Florida for a whole week. So they're like ready to go. Kimberly is actually at an event all day today, so she couldn't attend, but Terry and I are here and very excited because this is someone that is going to be a part of our healthcare series that we're doing, the healthcare crisis series. And we introduced it in a previous podcast. So if you're interested in that, please go back and look for that on whatever platform you watch or listen to. But this is somebody that we wanted to have on, somebody that has experience at the executive level in healthcare, but also has experience as a patient and understands how there may be a disconnect going on between, executive leadership within the healthcare industry and the patient level with the nurses and the folks that are actually doing it. So we just feel like this is going to be a great episode for us. And we're very excited. Dana Sherwin, thanks so much for coming on today. We really appreciate you and welcome.
Thank you so much. I'm very excited about our conversation today.
Yes.
We always start out, Dana, with just kind of understanding your story. You have a very interesting story that I've heard and Terry's heard a little bit about, but can you really just share kind of, your background in the healthcare as well as how that transitioned when, you got sick and things changed for you? Could you just give us a little bit of background on that?
Sure. In some ways, I was extremely fortunate. I had a father who worked for a health insurance company his entire career, and he was so excited about going to work every day and being in the field and helping people as a not-for-profit insurer. And I just absorbed sort of that excitement. And when I was 16 years old, he came home with 3 different pamphlets on careers. They were all careers in healthcare. One was a human resources executive, one was a dietitian, and one was a hospital administrator. And I said to myself, oh, that sounds like a great career, being in charge of a hospital. That seems so interesting and aligns so much with who I am at 16 years old, being the first child and wanting to be in charge and enjoying people and knowing how important healthcare was, both through my father and through family issues. And really, I was on that path from the moment I went to college. I wanted to study healthcare administration, but I had to wait for graduate school to do that. I went to the University of Michigan, have a master's in health services administration, and then came back to New York to start my career. And I had a really interesting and diverse career. I didn't just do one thing. I did many things. I worked for a hospital association. I worked for 3 consulting firms. And my last position was for a managed care company doing both Medicare and Medicaid managed care. And I helped start that plan. It was a small plan. And I helped start that plan. And while I was really having the best job in my life, my health crashed. And I knew that I had this genetic disorder. It was being monitored for like 15 years. It was a blood cancer disorder. And during the last few years of my tenure at running this managed care plan, really my health crashed and there was no other cure but a stem cell transplant. So that was 6 years ago, and I'm really happy that I am here today, to be here today, to be able to talk with you, but also I am feeling really good. As this past year has been a great progress for me. And so a couple of years into my recovery, I sort of woke up and thought, okay, well, what do I want to do the rest of my life? I knew I couldn't go back to a 24/7 responsibility of what I had previously. And one of my doctors said to me, my hematologist oncologist actually said to me, oh, you're such a great patient, Dana. And I thought, oh, that means my health is going well. I'm making great progress. She goes, No, I didn't mean that. What I meant was you come to every appointment with great questions, with follow-up. You keep us accountable for what we said we were going to do and what we've done. And I said, doesn't everybody do that? And she said, no, all patients don't do that. In fact, there's such a lack of participation and interest and follow-up. And I thought to myself, oh, it really sparked, well, maybe I know something that other people don't know, whether it's that I was an executive, a former executive in the healthcare system for 35 years, not really knowing what it was really like to be a patient, right? And the skills that I had being an executive, maybe that's what made me a good patient, but I decided I was going to do a lot of research on the subject, and that really has been. There are health scientists and health researchers who have studied the issue. What makes somebody engaged, and how does it impact their health outcomes? And I said, how come nobody talks about this? And I did research for about a year, and I started coming up with resources for people and thinking about it. Well, maybe this is my message. This is my work. And I, developed resources for people. I developed this guidebook that people could use for appointments with doctors, to prepare for appointments in advance. And I thought, wow, you'd think after all this time, being an executive, working in the field, and then being really sick for 7 years, that this is what I still want to do. This is how I want to spend my time, because I think I know things that other people don't. And,
right.
I know you both know how much of a psychological component there is to being a patient. And I think that's part of the equation, because the bottom line is no one likes seeing doctors. And someone could do anything else. Look at the people who put such effort into their hobbies, whether it's sewing or cooking or golfing or going to the gym, whatever, and they know all the details about everything. And then they just show up to a doctor's appointment, just handing themselves over. Okay, tell me what to do.
Yeah. And just real quick, just if you don't mind, just even the psychologically what's happening there is the stressors of illness. When somebody's dealing with a sickness or a diagnosis, the stress that comes with that, what people don't realize is it shuts part of the brain off. And you don't even know what to focus on. You don't know what questions to ask. You don't know any of that stuff. So we hyper focus on the sickness part of it, that we don't know what to ask. And so that sometimes feeds into that, right? And then and then a fear mode where we just become dependent on our healthcare providers, and we just trust what everyone's going to tell us. And we don't trust on ourselves and our own intuition, right?
Absolutely. And that's sort of one of the things that I did research on, and I came up with on my own, because that was my natural process. And believe me, I wasn't perfect. We could talk about like what I did wrong for my health. All those years I was in the healthcare system, it's like the shoemaker's kids have no shoes. My kids got great, I did well I just didn't take care of myself in the way that I should. But one of the things that I found so important is giving people a pathway and a framework, and making them understand this is not something that's taught in school, in higher education. It's not even taught to you by your doctors or health insurers or even your employers, who spend so much money on health insurance coverage for their employees, health and wellness programs, employee assistance programs. Employers spend all this money to the health for the health of their employees, but it's really up to every employee. There's no training or education how to be engaged in your care. So that's my message. That's my focus. And I have a lot of strategies and actions and tips for people to how to get good with that. Because when you get sick, there is, as you mentioned, Terry, there's just so much fear, and you tighten up. You just tighten up. That I don't know what to do. And no one's going to go to Barnes and Noble to buy a book on how I can have a good conversation with a doctor. Because when I was doing all this research, I got so excited, I can write a book on this. And I bought everybody else's book, but nobody buys these books. They're not bestsellers. So
true.
So I thought, okay, what kinds of like frameworks could I put out there? What kinds of messages could I put out there? And I'm really, in all ways possible, trying to get these messages out, that there are ways that people could do better. And so when you have these tools to do better, you put them in motion. Just like they say, do it before you feel it. Do it. Little steps at a time make you more able, more capable, and more confident to do the things that you need to do to communicate better with doctors. And so, those are the things I talk about. And if you want me to talk about like the framework that I've sort of developed to enable people to like hold on to something. And it's not for themselves, for their children, if they're a caretaker of a family member. It's like how to give somebody the structure when there's so much pressure, whether it's taking care of yourself or another person, there's so much pressure. And I have heard this from doctors taking care of their own family members who have to see other specialists that they're not that familiar with the specialty. And those other doctors talk to them, well, they're doctors, and talk to them in that very clinical or high level kind of way. And they're too, like, in a way, doesn't make them look good to say, okay, could you explain that in a simpler way?
Right.
Well, and that's the thing that I experience in healthcare is even when we're doing discharge instructions, you can gauge a little bit of what they're learning and what they're not learning, and you can ask them to, there's strategies of teach back. Can you explain to me what you just heard? But a lot of times, they don't express that, and then there's the time that we have to do discharge instructions with people, right? And so the engagement is the big thing. And like you said, and sometimes it's this, well, what are you going to do to just fix me? If I'll just come back, you'll help me. But no, we don't want you to keep coming back. What is it that you can do to help take care of yourself so that you don't keep coming back to the healthcare system? What are some things that you can put? So it's a partnership. This healthcare thing is a partnership. It's how do we help each other help you? It's not a one-way relationship here. And so that is a big piece, like you said. So yeah, framework is great because people don't know where to start, where to even begin with that. And like you said, you can read all the books and do all the things, but people aren't going to do that. It's got to be simple. It's got to be so simple for people to engage with it.
Yes, I think that's really important. So let me just give you a quick overview of what I did wrong that I would do totally different. And the first,
I would love that.
First was, everybody, their parent will take them to a pediatrician, and some pediatricians take people till they're 21. And then from 21 to 30, a lot of young people today don't even see a primary care doctor on a regular basis. And older people too, what I've found. And then you're this adult who wakes up and realizes, maybe I need to get a primary care physician so I can see a dermatologist or an allergist. I need someone to make that referral because that's how most health insurance works, that they will find one. For women, it's usually they are seeing, the only doctor they're seeing regularly is an OBGYN. Mm-hmm. And for me, that's what I had in my 20s and all through my 30s. My main primary care doctor was my OBGYN. And the health insurance company allowed me to do that. That was an acceptable choice for a primary care physician. Well, looking back, not at all. And I would never recommend that. And I know it's still happening today. So that's one big thing, because nobody was taking my blood tests regularly to see. I had a blood cancer disorder that my blood cells were abnormal, that some were high and some were low. And it would have been an early identification of a problem that probably was a genetic, not inherited, but a genetic disorder. It happens after birth, and your genes have a mutation for whatever reason. It's a fairly rare disease, and there's still no cure for this disease short of a stem cell transplant. So I was able to live with that disease for many years. But another thing I would have done earlier on too was have as many genetic tests as possible. Now, I know there are a lot more genetic tests available today than there were, 30 years ago. And one of the things for me, my mother and her sister had breast cancer, and they both passed away from breast cancer. And I was deathly afraid of having a genetic test for breast cancer. And so I ended up, for the disease that I have now, since it's genetic, when I was diagnosed in 2013, no, I'm sorry, it was 2003, I was diagnosed. There was a genetic test for my disorder. So I decided to have the breast cancer test with this genetic test. And it showed that I did not have the breast cancer gene, but I did have the gene for this blood cancer disorder. So that's one thing, because today, there's been such medical advancements in genetic testing. And I really believe that genetic testing abilities outpacing now doctors' knowledge of what's possible to do early, really monitor, early detection, so you can monitor a person's progress through that. Not everybody agrees, and a lot of people just don't want to know. I mean, I have 2 adult sons who, when I came back after my big panel that I had a few years ago, I said, I really encourage you guys, I think you should get that. No, we don't want to, because people don't want to know. I think I'm getting through to them, and it's going to happen. But
Right.
So that's another thing. I did put my head under this. I had many symptoms To me, they were mild. And us women, we're strong. We have many things to do, and we're go-getters. And what's a symptom here and there? I was strong. I had many symptoms of my disease that I did not talk to anybody or go digging. And now I would have, now knowing what I know, I would have done more research and talked to more doctors so that I could find an answer faster, because I wasn't diagnosed really till my late 40s that I had this disorder. And again, there was nothing they could do. And I was able to work productively. I had to be monitored by a doctor. In later years, I did participate in 3 clinical trials, hoping with every ounce of hope that this one was going to work for me. You're able to call up the pharma companies and talk to a chief scientist. Like, it's amazing who you can talk to, because these people aren't really out in the world. They're doing their thing. They're the chief scientist of this clinical trial, and you can call them and they'll talk to you about the drug and what they hope it will do. And it's sort of, for me, it's like exciting to know that there are these medical advancements, and there are people who work so hard on trying to, solve illnesses. Unless you're like in the world, or you have a family member that's sick. And now, because I have I'm not like full-time employed by a company, I'm able to do volunteer work, and I volunteer on the Blood and Marrow Clinical Trials Network. And so I'm part of this group of 125 hospitals who do trials on bone marrow transplants. And so I learn a lot about the field and how people get helped, and all what different populations and different diseases. And I'm really a believer in the more knowledge you have, the better you can think about new things when they come up. Some are positive, some are negative, whatever it is in your life. And it's really helped me on my path to communicate this message to people that you need to take charge of your own health. You're ultimately responsible for your own health. And it's a big part are the lifestyle issues, issues. And you could be going to the gym all the time. I have this, I was on this podcast with this guy. He's great. He really cares about people's like physical health. And he wrote a LinkedIn post that he hasn't seen a doctor in 3 years. He's in his 40s. He's an exercise physiologist, and he hasn't seen a doctor in 3 or 4 years. And
he's promoting that as a good thing.
No, he's not promoting it as a good thing. He said,
okay.
I finally saw a doctor after 3 or 4 years.
Yeah.
A lot of people.
You got to know your numbers. Numbers.
Yes. So a lot of parts of the country, there's not easy access to primary care physicians. People tell me there's a long lead time. to get an appointment with one because there's short supply. There's short supply for many reasons. It takes a certain type of person who wants to be a doctor for primary care versus somebody who wants to be a neurologist, someone wants to be a surgeon, all the different, a dermatologist, all the different specialties somehow are more appealing for, young doctors than primary care medicine. And if you're older than 65 years old, probably the best kind of primary care doctor is to have a geriatrician. And I was fortunate enough to, someone recommended one to me. And when I met him, I thought, oh, he's like 30, 40 years younger than me. I don't know. He's so young. Turns out he's a fantastic doctor, this guy. And so you never know. They have to really, doctors who want to understand like the whole person and help you coordinate your care. That's the kind of doctor that is the best and will be aligned with what your physical and mental health needs are. And you have to be the one that, in a way, fights for it to get the right kind of doctor for you. And it's not always easy because of the shortage around the country. And there are a shortage of geriatricians too, because only a handful of people want to be a geriatrician, and we're older adults. And that's an issue as well.
Yeah, I think that quite honestly, the younger generation of physicians are learning this holistic care. I mean, even the nursing. When I was I'm just graduating with my BSN. It took me 20 years to go back to school and finish it because I want to go on to get my NP in mental health. But I am 20 years ago, they were not teaching holistic care nursing, and now they are, and they're teaching nurses how to take care of themselves and how self-care is very important. But how to take holistic nursing into nursing and teaching things like meditation and all of the things that before were just woo-woo and we didn't talk about. But that's coming, that's forefront. So this is what is being taught in school now, and it wasn't before. So a lot of these new physicians that are coming in are learning this new holistic care. And you're seeing a lot more functional doctors come into practice, which is sometimes why I think we're seeing a lot less internal medicine doctors, because a lot of people are going into more functional medicine, where it's more the holistic person, right? And unfortunately, insurances have not bought into that yet, right? So it's not covered by traditional healthcare at this time. But yeah, I totally see that. And you said something that was so important. You just said, information, making sure that we're educating ourselves, advocating for ourselves, because nobody's going to come and do it for us. We have to take responsibility for ourselves. That is huge, taking accountability for ourselves. And I remember as I was growing up, ignorance is not bliss. Ignorance is expensive and it can be detrimental.
No.
In this day and age, ignorance is not bliss. There are so many things that we can go and teach ourselves, that we can go get knowledge and learn about, like you being out there educating your community and offering frameworks that you don't even have to go read a full book. You're out there offering and educating people. So the knowledge is there, but it is our responsibility to go out and advocate for ourselves. We can't leave it to the professionals to do it for us anymore. We're living in a time where just having the information is not enough. It's to go out and learn it and to live it for ourselves.
Yes. And one important example of that is, and you'll understand this as a nurse, medication management. All right. So,
oh gosh.
So, I start with know your medications as a patient. Know your medications. It's the first part of every medical interview. Let's go through your medications, see if any other doctors have given you medications. Let's see where you stand with all your medications. So sometimes people are told, oh, bring in all your or your bottles so we can go over it. It's not going to happen. All right. It doesn't really happen. It's a lot to carry around. Even if it's only 2 bottles, it doesn't make sense. What makes sense is these are your medications to help you or to be monitored. You should be able to pronounce the names of your medications, and you have to focus. It's like studying for a test. You have to focus. If you have 5 medications, you should be able to. Your doctor says what medications you're taking, or they're reading it off your portal, and you're able to go through that list because I had this experience, I have this question, I saw this new discovery. What does it mean for me? What are we planning for my preventive from happening again? All these things. So that's sort of one point. And everybody.
And most people don't know their medications. And this is why healthcare has done patient portals to help patients be more engaged, so that you can message your doctor privately on email and get a quicker response. You can look at your own lab results when they're available to you. You can look at your medications daily hazard and don't know what it is that you're taking. You can look and say, yes, this is the one I take. This is what it's for, how much I take. It's available to you on your smartphone through your portal. So I mean, I can grab my lab results right on for my last visit right now on my portal. So that is why healthcare is doing this, to help patients become more involved in their care. So if you're not aware of that and you haven't been supported in that with your provider, ask about it, because those advances are there for you.
Yes, absolutely. In fact, an older person at one of my community presentations said, I'm not really good at using my computer. I could see the results, but like, I want to print it out. I said, you just tell your doctor or tell the front desk and they will print it out for you. It's like, speak up and let them know, I'm not that good at the computer. Could you help me by printing out certain things for me? And I think that's important too. But also, the physician appointments are time limited. Some people say, they give me 5 minutes, 10 minutes. I mean, typically it's like 15 minutes or longer if it's an annual. Go quickly. If you're not prepared in advance and organized with what you want to accomplish, what your priorities are, what questions you want to ask, and other things you might want to share with the doctor about other things that have happened, you will not get through your list. So there are ways to, obviously, preparing in advance of the appointment. That's one of my very big messages. And you write it down so you have it in front of you so you don't forget. So there's this thing called hand on the doorknob questions, and that's the medical industry. That's when the doctor's saying, goodbye, Mrs. Jones, I'll see you in 3 months. And, oh, but I have one more question. I have one more question. I have one more question. Doctor, and you have to come in knowing that doctors have, these pressures of these limited appointment times too. It's not just you, it's the doctor as well. Right. And I think you want to do everything you can to make that appointment as efficient as possible, but also so you get your priorities addressed. Mm-hmm. And if they're not addressed by the end of the appointment, you say, doctor, I still have questions. How best to reach you in between appointments? And I have doctor's portal, or someone will give you their work email separate from the portal, or some say, just call the office. I will call you back by the end of the day. But it's very important to know and to keep that record. How does your doctor like to communicate in between appointments? And I know for me, that's, when I meet the doctor for the first time, that's one of the questions that I ask them.
That's a great question. I never even thought that a doctor would give you, a personal email or anything. I do everything through the portal as a patient. I go through the portal. I look at everything. I do my refills. I communicate with, and I go to a physician's assistant. I don't have like a medical doctor. That's my regular primary care. I have a PA. Her name is Melissa, and I just love her to death. Have a great relationship with her, and she's the person I go to regularly. But I was going to say something about the preparing for the appointment. Because as a patient, me, the mistake that I could make, all this I just want to caution everybody out there, please do not do that. Do not do that. What I think you guys are saying, this is somebody who doesn't have any, background in the medical industry, is to just look at what you're taking. Maybe, start asking questions. If you're having any kind of side symptoms or things that are happening, it could be a symptom of the medication. Yes. It could be those kinds of things. I think what you're saying is for us to be very much aware of what we're on, why we're on it, what we're on and why we're on it. And is there a way to try to look at what's going on underneath that pill? As an example, I'm on cholesterol medication, but I I know how bad statins are for you because I don't have statin anymore. So I said, I don't want to take that. So is there a more natural way besides, just eating better and getting more exercise and all those things? A blood test alone, this is what I learned. A blood test alone doesn't automatically determine that you're susceptible to clogging arteries. You have to get the scan to really determine that. So you don't really need to go on a statin necessarily. I'm not a doctor, so I'm not giving medical advice here, guys. I'm just saying, and if not, what do I have to do to not be on a statin? Kind of thing. Does that make sense?
So I'm not a medical doctor, so I'm going to put that disclaimer out there. You have to follow your doctor's advice. But one of the things that I do take, because my dad had a lot of side effects with statins when he was on it, I take a supplement called red yeast rice.
Oh, okay.
And that has brought down my cholesterol levels quite a bit. And so I'm not on a statin, but that has proven for me,
yes, right,
with my blood work, with my doctor, has helped with my cholesterol. And because my dad's side of the family has had typically high cholesterol in that side of the family. Yeah. So, and I know that my dad did have a lot of side effects with statins. That is one supplement that I take, but I would always tell you to take it and coordinate with your doctor. Yes. And have him monitor your blood while you're taking it and see if you're getting an effect.
I told Melissa when I went to see the last time, I go, I've been a bit of a rebel. That's what I told her. Yeah. I stopped taking my statin, and this is not what it was recommended. So I'm not saying this is the right thing to do. Sometimes you go off the deep end trying to be too much the other direction. I'm not doing that. Yeah. That's not what it's like. Come on, you guys. So it's like, it is working together as a team. It is a team collaboration.
Well, and what I would say is I would, if he has you on a statin, I would maybe take maybe have him monitor you that with the statin and then add the red yeast rice and then maybe see what your blood work looks like in 6 months.
That's what we did. That's exactly what we did.
And you make sure that it has the CoQ10 with it.
Yeah.
And then
take that as a separate thing. Yeah.
And there's one that has both combined with the red yeast rice and the CoQ10. That's what I take, and it's been pretty helpful.
Yeah, absolutely. So that's just an example of being an advocate. But I really had a question for Dana because she has been in at the executive level. What do you think? What kind of education is happening for hospital administration that really helps them focus on patient care? Do we see a change happening there? How do we educate at the patient level? How do we change that or do anything about that?
Okay. Well, there's a lot of components to a hospital and the operations of a hospital. And so there's the inpatient and then there's the outpatient and there's this surgical procedures. And then there's special departments that do special outpatient work. And so it doesn't really all work together. They're all services that are offered. But one thing that is really happening in a big way is focus on the patient experience. And there are now certifications to be patient experience experts. And there are professional associations that bring the people that work in that kind of position together, for giving them education and tools and trying different things. And this has been brewing for the last 25 years. But when I started into my entry into what could make the physician-patient conversation better, I found these groups, the patient experience groups. The problem with the patient experience groups is that it focuses, again, on what this provider, this big provider, whether it's inpatient, outpatient, whatever the services are, it's about how the processes, the healthcare delivery processes could work. And it's really not about educating the patient or giving the patient tools to do it better. It's what can the hospital operations do to create a smoother and more effective process for delivering that care. And so there's not a specific focus on patient engagement, patient responsibility, and patient. There are, dribs and drabs of it. You could point to it, but there's no strategic initiative that says we need to upgrade
Exactly.
how patients participate with
Because
us as healthcare
sometimes it's the
providers.
patient's experience that they didn't get a regular diet that has all the sodium in it that they want when they're on a diet that they can't have all the sodium that they want. And they're complaining about the food that they were getting in the hospital. So sometimes patient experience is on perception as well.
Yes.
So that's the problem with those patient experience things.
Right. Well, it's also very sporadic. So people are in an acute or emergency kinds of conditions. And so all the effort is getting the person the care that they need and not preparing them for, as you said prior, for discharge or for monitoring symptoms. You go to a really, high functioning hospital, somebody will call you post discharge. Or I had a colonoscopy recently. They call you the day after to see how you're doing and if you have any questions. But, it always rubs me the wrong way, whether a doctor says it or whoever says it. Do you have any questions? Most people do not know what questions to ask. And coming back to that route, one, limited appointment times for physician at the end of where he or she wants to wrap it up. Do you have any other questions? If the person is not prepared with questions or doesn't have any of the questions that I suggest, if you don't have anything to ask, I suggest these are the questions that you ask. Then, you say, no, I can't think of anything, because people can't think on the spot. It's too much, as you said, pressure, stress, fear. You cannot think on your feet in an appointment. I mean, maybe you think better on your feet if you're in an emergency room and you want to get treated and you're just blurt out all the things that are happening to you and that you're not feeling well and you do all that. But on a regular, non-urgent appointment, if you don't prepare for that appointment, the questions you were feeling, and also what you want to achieve. Different people have what's your goal? Next month I want to get on a plane and travel. Can I do that? How can I go and do that? Depending on the information, so I guess my area of focus right now is on that physician-patient relationship, because I think so much, you can learn so much, but you learn so much before, during, and after the appointment. So it's not just the appointment. How many educated friends, colleagues I have, well, I'll say, oh, you told me, you had an appointment with your, let's say, your gastroenterologist. She said you were, what happened? Yeah. People. So they don't remember, because if you don't write things down, and this is not just old people, everybody, it is actually, there is science behind writing things down. That hand-brain connection, you write it down, you remember it better. And I'm not making this up. There's so much research on that. You write things down. I mean, there was a recent article about how a professor is now forbidding cell phones or taking notes on the computer unless somebody has a disability, because people learn better by writing things down, and you're thinking about it, and you're not doing it verbatim, and you're not just typing verbatim. Let's say you want to write everything the professor says down. It's the same thing. I have a notebook, and I did this before I really studied this issue. And this is one thing that sort of launched me, because I was doing so many things right that seemed to be right and helping. And the physician responded so enthusiastically. I mean, I'd sit with a notebook on just making short notes. It didn't have to be verbatim, or what I needed to look up another time, because I knew I didn't want to take the doctor's time explaining something if I could look it up on the internet or to find out more information, because you can ask those questions. Okay, well, what should I expect from happening with taking this drug or having this procedure? What should I expect? What are the risks? What are the benefits? All these things, a conversation with the physician. What has happened? What's been bothering you? Well, how long did it last? I mean, there's a whole study of related to pain and having pain journals. People suffer from migraines or from other, orthopedic kinds of injuries, that sometimes it's really helpful to keep that journal of what the date, the time, what were you doing when that happened, and how you were feeling, how you're feeling. And one thing, I had a lot of bone pain, and I didn't know how to express it. So this was after my disease was identified, but I was having a lot of bone pain, and I would go to the doctor, says, I don't know, it's like flu-like symptoms, it's like bone pain. And they wouldn't really say anything to me. They just nod their head. And so while I was doing my research on communicating better with doctors, I found that somebody had studied and come up with a really a framework for the language of pain. And they came up with, I think it's 72 words that express pain. And I looked at these words and I said, I wish I would have had these list of words to express. I'm a big vocabulary person. I needed these words to express what I was feeling. And how come doctors' offices still have those smiley faces, one which is the face that describes how you're feeling? Well, from my perspective, that's not precise enough. People need to have the words and the vocabulary to express how they're feeling. And so that was sort of another very big finding for me. And I talk about that. I share that when I, talk to groups about knowing the language of pain and knowing the language of your disease and be able to interact with all of that.
I love that. Is there a place that they can go to actually get? Do you have like things?
I have a reference.
Templates or books or things like that where they can actually, write these things down or get some information or what the questions to ask. Where do they find that information?
Well, I did develop it's called the Thinking Patient Planner.
Oh, okay. Oh, there you go. Okay.
But I don't sell it directly to consumers. It's part of, like, when I make a presentation, if people want it, if it's part of the program that I'm doing, to be able to distribute it and also describe it and discuss it. But you don't need it to do the things when I talk about, like, how to prepare for the appointment. And part of the preparation also is getting your mind into a mindset where this is business. What is it that you care about in your life? How long do you spend looking to buy a new car, and the spreadsheets you might make and all the dealers that you go to? Would you put that much effort into your own healthcare? What is it that I want to do for myself? Preventive, take care of current issues, follow up, monitoring, all the things you want to do. Aren't these things important too? I mean, everybody knows that, the basics: drink water, exercise, nutrition, all those things. And, for my complex disease, these are also for my recovery, to stay healthy. That's what doctors still tell me, the 4 things that you need to do. And now that I have osteoporosis, and I'm taking drugs for osteoporosis, it's all the things I knew for muscle strengthening and eating well and all those things. And they're like baseline things that everybody should do, so that if you have the experience, and it's more common than we think these days to have some chronic disease that you need to take care of, don't you want to put that same level of effort that you do into, whether it's your professional life, your work life, your whatever hobbies you have, anything? Aren't your family health, how important it is? And, in a way, I grew up knowing how important health was, because I had parents who were overweight. Their parents died from heart conditions and breast cancer. And so this was such, part of, like, the blankets that surrounded me. And as a young person, I was focused on eating well, and I was focused on exercising, but I didn't go to the right doctors. But when I had my children, I did whatever I could to take care of any little health issue that came up for them.
Right.
And
that is so true. And that's really the kind of theme behind our entire podcast too, Dana, is self-care. And not only from the medical perspective, but also from, mental health and the trauma side, and how that impacts your body in a negative way, and how you hold on to it, and the things and the symptoms and things that come from that. So really, our entire podcast kind of, you just summed it up really nicely in what you just said, is really around taking care of you in every way, medically, mentally, in every way. And so you just described it so great, because it's one aspect of your life. Why wouldn't you put as much energy into that as your, your golf scores and your all the stuff that you follow every single week, and you put a lot of effort into. It's so important. And that's really what this podcast is about.
Well, self-love and self-care is advocating for yourself, and
Sure
not leaving it in the hands of professionals who don't know you, and just leaving decisions up to them. Like you're part of this, You're part 100%. You're part of creating your outcomes, your own outcomes.
And one thing I found in my research was that 50 to 70% of people withhold information from doctors. This is sensitive or confidential information. But it could also be that you stop drinking coffee and you have these bad headaches. But if you don't tell the doctor, I stopped drinking coffee, the doctor will give you like all these like tests, or go to this doctor, this doctor, this doctor, when you could have said to the doctor, I've been drinking a lot of coffee my whole life and I just wanted to stop, and they stop, but you don't share that with the doctor. I mean, that's a very small example, but there are other things too. Like you said, I stopped taking my medication.
So a couple of things there. You said, I worked on a surgical unit for many, many years, and they had to be without eating or drinking for sometimes a few days, sometimes at least 24 hours if they were waiting for a surgery, or if they had bowel rest and they couldn't eat for a period of time, and they would have these major headaches. And they would complain about it, and we'd give them everything we could to try to take away the pain of a headache, and we couldn't take it. And the first thing I would ask them is, do you drink coffee? And they would say yes. And the first thing I would do when I was able was to give them caffeine, or I'd give them something, an Excedrin or something that had caffeine in it. And that was the only thing that took it away. And it was just asking the question, do you drink caffeine? Well, yes, I do. I drink it daily. And yes, it was a caffeine headache. But the other thing from that was, when working on a surgical unit and people were struggling with pain after surgery, and we couldn't manage their pain. And I remember asking someone one time, is there anything recreational that you use? And they were like, no, didn't want to say anything, and I said, the only reason I ask is because if you do, I can go advocate for you with the provider to get you something that may be able to help you a little bit more. And so shortly after, he called me back in the room and said that he smoked marijuana. And so I went and told the doctor, which means he probably had a higher tolerance he probably had a higher tolerance and needed probably a little bit higher amount of opiates to be able to manage his pain. And sure enough, we were able to get him a little bit more medication, and it took away his pain. So it's it's so important that you're honest with your healthcare team, because it changes the way that we can help treat you. Lying and not being upfront, not lying, I don't want to say lying, but not being upfront with the right information, or even somebody who's struggling with substance abuse. It can change the game in the way you experience a withdrawal. And if we don't know how many actual drinks that you have per day, we're not going to put you on a protocol that will actually help you go through that with much more ease than if we have to find out when you're in actual withdrawal, and hopefully not having a seizure and going through some terrible, terrible experiences. We can help you not go through that if you're honest about it. So it totally changes your treatment.
Absolutely. Many people, when they're meeting a doctor for a first time, they don't want to really let them know.
No. Yeah.
But maybe knowing it, how important it is, and talking about it and including it, and even doctors or nurses talking about it. Look, we need to know it's all confidential, and it's really an important thing. And we want to know, okay, well, is it related, to your lifestyle or your financial situation, or even it's a home situation? What if somebody is being abused in their home and they come in and they're not really talking about it? And then you lose that part of the doctor loses that part of the picture of how best can I help this person.
Yeah. And this is my passion, Dana, and this is why I'm so passionate about healthcare providers as a whole in the healthcare system being trained as being more trauma informed. I think it needs to be part of every curriculum for providers. It needs to be in nursing school. It needs to be in teachers' curriculums. It needs to be in law enforcement. We need to be trauma informed, because when we understand that, then we can, then we look at a person's communication. We don't think that they're being non-compliant. We see it as some kind of communication, right? There's something going on here. What is this behavior telling me? And we're not judging our patients. And then when we're not judging them, we can serve them better, and we can advocate for them more. And then we're not re-traumatizing them and causing them more pain to where they don't even want to come and seek the care that they absolutely need. So that's my passion. That's what I'm super passionate about. So
beautiful.
As you said, you were part of that same system. I was a healthcare provider and felt like I was being judged when I was going through my own mental health issues. So I totally get it.
Mm-hmm.
Yes.
It's all about advocacy and learning to
good tips here, Dana. Where is there somewhere that they can find you if they want to get in touch with you for whatever reason, Dana? Where would they find you?
So I'm very active on LinkedIn. I post on different content on subjects that interest me and sort of round out the equation for people to learn more about how best to take care of their health and have good communication with doctors and things about how doctors are trained and all that kind of stuff. So you can find Dana E. Sherwin on LinkedIn. You'll find me easily. And there's like a lot of content there. I have a website also, thethinkingpatient.com, which is really focused for healthcare organizations and employers to get services to support them, to support their employees, so their employees become better patients.
Love that.
Love that.
Thank you so much, Dan, for coming on. Again, this is a part of a series we're doing for the healthcare crisis, and we're calling it. And this is in that series for us, because we really believe it's important not only for the healthcare side and what can happen there to maybe provide better care or maybe take better care of themselves, with what we'll talk about with nurses, but also the patient side. I love the fact that we talked about, being a patient yourself and how you can go in and actually be a better patient, for lack of a better word there, but just being able to advocate for yourself and ask questions and be prepared. And I just love that we're talking about it from that side, because that's the only side I've ever been on. So I don't even understand the other side. So I get it. For me, that makes perfect sense. So Dana, thank you so much for coming on. We appreciate it. And those of you guys, we have a link to her website in the show notes for this. If you're listening or watching on YouTube, you can click on the link and go to her website. And we appreciate it again, you coming on.
I just want to say now to our audience out there, now you guys have more guidance, and now you have some tools to be the better patient and to get more educated and be participants in your own care. So thank you, Dana.
Thank you. It was great meeting you.
Yeah.
Thanks, everyone. Thanks for listening. Thanks for watching. Click and subscribe.